Hello students, this is Ms. Price and this video is on ethical responsibilities in healthcare. Our objectives for this video are to define ethics, to understand the ethical dilemmas that are created by modern medicine, and then to list some basic rules of ethics. So first off, what are ethics? What does this word even mean? Ethics are different than laws. Laws have to do with what is legal or illegal. And we discussed in talking about the legal responsibilities in healthcare about criminal law and civil law. Criminal law, you can end up going to jail. Civil law, they're suing you for damages. But ethics are different. Ethics have to do with what is morally right and morally wrong. And so in medical ethics, it is a system of principles governing medical conduct. The biggest thing to remember about ethics is that it is dependent on different people, and it is also dependent on where they live. So the example that I always give students is if you heard that at the little gas station in Lexington, the Shell station in Lexington, that there was a group of 12 to 14-year-old girls that were all dressed in the same color, and they were prostitutes, and they were being prostituted out of the Lexington Shell station in broad daylight. Would you think that's okay? And students normally think, no, of course not. That would be horrible. But in Thailand right now, that is happening, and no one bats an eye. So ethics is really dependent on culture, but it is what is considered morally right and wrong. So this is why we have some differences in opinion when it comes to medical ethics. Some that we will discuss are euthanasia or assisted suicide, DNR or do not resuscitate, and living wills are some of the things that we'll discuss that have to do with medical ethics. Most of these ethical dilemmas that we face have actually been created by modern medicine. Before modern medicine, we didn't have a way to do these things, and so they weren't an issue. But now that we have a way to do these things, then it has created an ethical dilemma. Is this right or is this wrong? And if we think it's right, then how far is too far, and who makes that decision? So probably the biggest one at the moment is euthanasia. Euthanasia is legal in certain states, not legal in the state of Alabama, but it is legal in many states. But they have different criteria. So who comes up with that criteria, and who decides what's right and wrong? So this is why euthanasia is such an ethical dilemma. Confidentiality about AIDS diagnosis. Should a patient be able to keep that confidential and then not tell healthcare providers that are going to be taking care of them? If we're using standard precautions, then we should be using the precautions to take care of ourselves without knowing this. So is that unethical for them not to tell us that? Aborted fetuses in research. If the fetus has already been aborted, why shouldn't we use it for research? These are just, I'm not telling you what I believe, I'm just saying these are some of the dilemmas that come up. Continued life support. Should we keep someone on life support indefinitely if they have no quality of life, or if they're brain dead and they're brain damaged, and maybe their family just wants to keep them alive? Should they be allowed to do that? Expensive treatments and payment. Should someone not be able to get a life-saving treatment just because they don't have the money? And then transplant decisions. You know, I've used the example multiple times. If you're in a car accident and 95-year-old Papa is in a car accident, who is going to get the liver if you both need a liver? Well, it would be you instead of the 95-year-old Papa. But who makes that? Who has the right to make those decisions, and what makes one right and one wrong? A few other ethical dilemmas that you probably have heard of. Medical marijuana, that is one of them. Should people be able to use that for pain, and who's going to regulate that, and what are some of the criteria to go along with that? Animals in research, genetic research, cloning, stem cell research. All of these things have been created by modern medicine. So what are we going to do about all this? We can't solve all these ourselves, and there will be some that you will have to probably vote on in your lifetime. I would highly expect for us to vote on euthanasia as a state probably in the next few years. So, but as medical providers, what can help guide you as you make decisions for your patients and for yourself and your family? So if we just keep these things in mind, I think it will help us to guide our ethics, is to save lives and promote health. Always be looking to save a life and to promote health. Patient comfort is very important, and even if that patient is a do not resuscitate, we need to always keep that patient's comfort in mind. Respect of the patient's right to die peacefully and with dignity. This is part of that DNR, do not resuscitate. Patients do have the right to die, and sometimes we don't always allow that, and we try to, and I know I just said save lives and promote health, but it's a balance there of saving lives and then giving patients the right to die peacefully and with dignity. Treating all patients equally is absolutely vitally important. It doesn't matter if it is a celebrity or if it is a homeless person. We need to treat all of those patients equally. Always provide the best care possible. And in order to provide the best care possible, we need to maintain competence in our skills and in our knowledge. And this is ongoing. School is never out for the healthcare professional. They are always learning. All right, just a few more. Respect rules of confidentiality, which are very important to know what you can say and what you can't say as far as HIPAA goes. Unless the patient has checked in as they don't want any publicity, then everybody can be told, yes, this patient is here, and a one-word status, like they are in good condition, they are in critical condition, something like that. It's a one-word status, and that you can say that they are there. And give a room number. That's pretty much it. Births and deaths are matters of public record, so those things don't have to be kept confidential. How they died, and obviously that is, but if someone has passed away, that is a matter of public record. Refrain from immoral, unethical, and illegal practices, and show loyalty to patients, coworkers, and employers. Be sincere, honest, and caring. I feel like if we do that last one, the other ones will fall into place. All right, let's look at a few professional standards in healthcare. So our objectives for this section are to define the scope of practice and why it is important to healthcare providers, and then also to list and discuss some professional standards. So scope of practice, what does this mean? A scope of practice describes what a healthcare professional can do or cannot do. So nurses can do some things, and there are some things that they cannot do. And so and it varies by state also. So as a nurse, I'm only going to do the things that I have been trained and are permitted to do. And there are things that I have been trained to do that I'm not permitted to do, such as place a breathing tube. If you can remember back when we were doing the respiratory system and we put in a breathing tube. I've been trained how to do that, but in the state of Alabama, it is outside of my scope of practice. So I cannot do that in practice, even though I know how to do it. It is very important for healthcare professionals to know what they can do and what they cannot do. Ultrasound techs, there are a lot of things that they can do, but there are things that they cannot do. Unless they've been trained how to do IVs, they cannot do those. Whereas x-ray technicians, most of the time, or especially if they do CT, they have been trained how to do that to where that they can do an IV. But you have to make sure that you are not only trained to do it, but that you're permitted to do it in your state. I'm pretty sure at a breathing tube, I could place one in the state of Tennessee, just a few miles away. But if I'm and I do hold a multi-state license, so if I was practicing in Tennessee, I could do that. But in the state of Alabama, that would be illegal and could put my license at jeopardy. It's so important for the first thing that I said, it can put your license in jeopardy. For you personally, that's probably the most important thing. But for patients, if it could make us cause injuries. So working outside your scope of practice can make you liable for injuries if there's any injuries that happen. So if a legal situation were to arise, you could be held liable for a standard of care beyond your training, experience, and job expertise. And held liable means they can sue you, and you would have to pay money. And working within your scope of practice also ensures that you don't injure someone or put them at risk by performing procedures that are beyond your ability. All right, so let's look. I've got top 10 professional standards that this will help you with in your professional practice one day. Is always identify your patient. Make sure that you have the right patient. And I know that sounds like it should be common sense, but sometimes it's not. And remember back when we talked about safety, identifying your patient 2 ways. So the armband is one, the chart is another. The armband and asking them their name and date of birth, those are ways to identify your patient. Obtain your patient's consent. You need to make sure that the patient has consented to the procedure. Now, we're not going to give them a consent signed form for every single thing that they do. Like, if I say we're going to start an IV and the patient doesn't say anything and gives me their arm, well, that's implied consent, okay? But for things that like surgeries, but you still need to get their consent. Like if you're going to start an IV, is that okay with you? For most patients, of course, they're going to say yes. If they know that they're there for surgery, they know that they're going to get an IV. But you still have to tell them what is happening and why. Always observe the safety precautions that are part of your employer's safety precautions. Keeping all information confidential, again, that one's there, again, for professional standards. Think before you speak and watch everything you say. I know that sounds difficult and looming and daunting, but just so you know, mean people don't just go away after you get out of high school. There are always people that are going to be trying to get you in trouble for something that you said or something that you did. So you need to really be cautious about what you say and who you say it to. And don't even join in a conversation. Sometimes if someone is talking about, let's say they're having a conversation about the boss, and it gets back to the boss, and you might not have said anything, but you were in the room, well, all of a sudden you're guilty by association. So you really need to be cautious about what you say and who you say it to. Always want to treat all of our patients equally. This is so important. Again, it doesn't matter who they are. We want to treat all of our patients equally. We are not allowed to accept tips or bribes for the care that we provide. Can't do that, and you might have someone offer you that, but you have to say no. It would be unethical for you to accept a tip for care that you provided because you are paid to provide that care. This is not a restaurant where you can accept tips. If an error occurs, you report it immediately to your supervisor. Do not wait. You have to report it immediately. That is ethical and professional. You want to behave professionally in your dress, in your language, in your manners, and in your actions. And then always carry liability insurance. Let me go back to this one. I'm not saying that you will not hear profanity in a professional setting, because I've certainly heard plenty of profanity in a hospital, but it isn't professional and it isn't appropriate. So separate yourself from that, because if someone is offended by that, they can then go to Human Resources and say it's harassment. So just make sure you separate yourself from that. Always carry liability insurance. That is so important after you get your license and whatever it is that you're going to do. Maybe it's ultrasound, maybe it's x-ray, maybe you're going to be a nurse or a doctor. You want to make sure that you have that liability insurance. The hospital will have liability insurance, but the hospital they are protecting themselves. You need something that protects you. It costs very, very little, and it just gives you peace of mind if you were to ever have an issue that someone was to sue you personally for care that you provided or that they didn't think you provided correctly. All All right, I found this quote. I thought it was great for professional standards. Actually, I think it's great all the time, but great minds talk about ideas, average minds talk about events, and small minds talk about people. And that's a quote from Eleanor Roosevelt, and a friend of mine back when, before we had cell phones and we had like one phone in the house and you had to go, like pick up the phone and dial it. Her mom put that by the phone just to remind her every time of what she was talking about. So, all right, that is it for ethical and professional standards.